So hello everybody and welcome to another episode of the podcast, which we call Emotionless Investing. And I'm pleased to introduce a good friend of mine, Dr Khalid Abdel-Galil, one of the nicest people that I've got the privilege of knowing and meeting. And he's actually a consultant maxillofacial and head and neck surgeon at Tawam Hospital in LA. So thank you, Dr. Khalid, for your time and coming onto the podcast.
Hello, James. Thank you very much. Thank you very much for having me. It's really a pleasure and a privilege to be with you today. I always value our time together, and we always have a good chat when we meet. So thank you again for having me.
No problem, no problem. The pleasure's all mine. So what I wanted to do, I've always been inspired by many of the things that you do, that I've known you over the past few years, and I wanted to just really tap into, I guess, your psyche and how you've got to where you are today, how you've achieved the things that you have, and what's led to the success, and try and share some of that with anyone that's listening in, and hopefully they can pick up parts of it and help them along their journey. So I know that you've got quite a lot of initials after your name, and you're a very successful doctor so you're a dentist and doctor, because you do the maxillofacial, you do anything that's to do with, do you want to tell people a little bit about actually what it is that you do?
Sure. Thank you for the intro. Before I do that, it's a thing with initials. Doctors will tell you that the more initials you have after your name, the more prestigious you are. So most doctors have some form of initial, or many initials as it were, after their names. So that's just about that. But going back to my career, my profession, I'm an oral and maxillofacial and head and neck surgeon, as you said. And what that is a branch of surgery that deals with head and neck, jaw, facial, and head conditions. Broadly speaking, that can be trauma, injuries, tumors, benign conditions, cancerous, malignant conditions. It's a broad range of conditions affecting the head, face, and neck. And as you quite rightly said, that involves training, which is quite lengthy actually, compared to any other branch of medicine or dentistry. It is a unique specialty in that, as you again quite rightly pointed out, you have to be trained both as a dentist and as a doctor. And that's partly why the training is so lengthy. So you have to go to university twice, study either dentistry or medicine, and then go back again to study the other discipline, whether it's dentistry or medicine. In addition to all the extra training after qualifying as a dentist and as a doctor. So it is quite lengthy. But it's a unique specialty, and I enjoy it. And it's a relatively small specialty. There aren't many of us, around the world, and that's partly why it's interesting.
So, what got you into medicine in the first place? Then, did you always know? Because your father's a doctor, right?
So that's an interesting question. I get asked a lot. I'm from a medical family, and that probably played a big part in it. Actually, my father is a doctor. He's a retired surgeon. My older brother is a doctor. He's an orthopedic surgeon, and we have various other members of the extended family who are in the medical profession. So that probably played the major part in my decision making. I always looked up to my father as a doctor and as a surgeon, and found myself, following in his footsteps at that early age. As a teenager, you don't really have much in your mind as to what to do or what you want to be. And so I followed in his footsteps. It's interesting because I did not do medicine. I did dentistry. And that's one of the other interesting twists in my life.
So the first thing you did was dentistry. Okay.
Exactly. I wanted to study medicine, following in my father's footsteps. I didn't have the grades to do medicine. You get a choice of degrees. My second choice was dentistry. My grades got me into dentistry. So at that time, reluctantly accepted to go into dentistry. But in retrospect, I think, we may discuss this later, it was the right decision, because I then eventually did medicine, some years later. But it was dentistry to start with, not medicine.
Okay. So how many years in total then at university and all the studies before you actually was a practicing doctor dentist?
You're about 18 years. 18 years.
18 years.
Including
And
the university degrees.
At any point during that, did you say, I'm going to change career, or I've had enough, or this isn't what I want?
Not at all, James. Not at all. Most people get surprised when I mention the figure of 18 years, but actually I've never looked back, and I've never regretted it. Simply because I was going in the track following the training for this specialty, which as soon as I hit dentistry, started studying dentistry, I knew that that was what I wanted to do. And I knew that that was the career course to get me to that destination. So despite it being lengthy, but throughout it, I had a target in mind, and that's what kept me going. I never regretted it at any point.
What was that target? Was it what did you visualize that you said, I'm just going to keep going and going and going, that gave you that drive?
So I visualized myself as a surgeon, as a maxillofacial surgeon, and okay. That was a career kind of decision that I made early. I mentioned earlier that as a teenager, you don't really have much in mind about what you want to do in the future. As soon as I started my first undergraduate degree in dentistry, within a couple of years, I had exposure to oral and maxillofacial surgery, and I knew that that's what I wanted to do. So I kind of set that target early on, and it started from there.
Okay. And it's everything that you're doing is continually learning. So you have to do like continual professional development. I know you always go on different courses. You're a speaker at different events. Yeah,
that's part and parcel of any doctor's life, really. Not just surgeons, but any doctor's life. You know, it's a lifelong learning process, and it's not just about ticking boxes. It actually makes you a better doctor. It makes you a better professional healthcare worker, and it works both ways, because you go to courses, to conferences, to congresses, you learn, but you also interact and you share your own knowledge and your experiences with colleagues. So it works both ways. You receive and you provide that knowledge, and it works as a good, you know, lifelong learning exercise, and it's a must. That's one of the things that I really enjoy in my working life. Obviously I enjoy, you know, the everyday kind of work, but I also enjoy my learning that I have to go and attend in courses and congresses and meetings and so on. So yeah, it is a lifelong process, and it's part and parcel of
continual learning.
Profession. Yeah.
And I mean, anyone listening should, but with warning, have a look at Dr. Khalid's LinkedIn page, because you do showcase some of the surgeries that you do, which is, I mean, it was an insight for me as to, it's quite graphic, but it's impressive, and you can see that it's I imagine that's going to be quite labor intensive. You know, some of the surgeries that you go into, but now you're at the stage that you're at, what percentage would you say would be the physical with the hands, you know, the actual physical part of it, and the mental part of it, like the know-how, the confidence that you have to have going into a surgery? Like, can you put a percentage on it in terms of what gives you that skill set?
Yeah, I probably can. It's interesting, as you progress in your career, that percentage changes, James, and that's always been mentioned by you know, doctors, clinicians, as they progress in their career. So when you train to become a surgeon and you're a young trainee, your focus, your mind is on, you know, the cutting. You just want to get and do the surgery, and you want to, you know, finish your training so that you do as much surgery as possible. And that's fine. That's fair enough. As you're starting your career, you want to really be doing as much surgery as possible. You then progress into your career and into your mid-career and even more senior levels. The actual physical part possibly starts trending down, and you start becoming more, as you say, mentally focused. You finesse your surgery. You kind of how can I put it? You still do surgery, but you do it in select cases. You may be doing more complex cases. You select your physical activity, as it were. And then it becomes more mental and more face-to-face with patients or clients, as it were, in clinic and in outpatients and so on. And you have more senior, leadership roles, and it becomes more non-technical skills, if you like. So that shift happens, career-wise, and people see it across specialties in medicine and healthcare. But surgery is a technical profession; it's a technical skill.
Oh, sure.
You do it day in and day out. But as you progress in your career, I think you see more involvement in leadership and non-technical work. Although personally, for me, as I'm sure any surgeon will tell you, my days in the operating room are really the closest to my heart. And that's what I really enjoy my working life.
And when you do your studies or you do the continual development that you're doing now, did they ever talk to you about the psychology side of things, making sure that you're mentally prepared, protecting your confidence, maybe if a previous surgery didn't go well, or did they ever talk to you about that, or was it more about the technique and
So it's interesting, and again, there's been a shift in that. So as an undergraduate, let's divide this. So there's the undergraduate when you're training, and that's a really general training. You don't get any details about surgery there because you have to cover every sort of specialty in the 4 or the 5 year course. So you don't get any there, and then you become an intern or a resident in surgery, and that's when you start surgery proper, the technical skills. In years gone by, there was hardly any training in the psychology, in the mental skill set, in the non-technical aspects, if that's what you're asking. There was hardly any of that. There was some, but it was very minimal. And I certainly recall in my training days, which were a long time ago, there was very little of that. And I think then the surgical profession became aware of that, and increasingly over the recent years, that has increased, and quite rightly so. So there's now a big focus on the training of the non-technical skills, the psychological aspects of becoming a good surgeon. Because becoming a good surgeon is not just about the surgery; it's about being a teacher, being a leader, being a coach, being a trainer, being an advocate for the patient. So there's a multitude of attributes that you have to have as a good surgeon. And interestingly, again, in the last few years, there's an explosion of human factors research, human factors work, which pretty much covers a lot of what you're asking about in not just surgery, but in healthcare as a whole. So I'm pleased to say that's increasing. When I was studying, there was not much of it. But again, that's the purpose of continuous learning.
Of course,
I've not done it my early career. I can still catch up with it now, and that doesn't stop. And I'm, continually learning.
I think we're seeing that across a lot of industries as well now, that people are really starting to understand the mechanics of it, not just with us as a person, but like you said, you're in there, you might have, how many people would you typically have in the theatre then with you that you are looking at you're the manager too, you're asking them, you're giving them orders, instructions?
Yeah, so the number varies. You're clearly the leader in the room for that particular case or that particular operating list, but there are a number of people in the room. Surgery, like many other healthcare disciplines, is a team effort. It's a team sport, and I really must emphasize that. Surgeon is one part of that team, and the team is as good as or as weak as the strongest person or the weakest person on the team. So team building is important, and I'm really proud that wherever I've worked, I've managed to have good teams. In answer to your question, there could be anything from a minimum of 4 to 5 people in the room to anything up towards 15 to 20, depending on the case that we're doing. So sometimes we have multiple teams in the room, a surgical team or 2 surgical teams and 1 or 2 anesthetic teams, again depending on the complexity of the case, in addition to nursing staff, the operating nursing staff, circulating staff, and so on. So the number varies by case.
I guess there's a lot of moving parts within that, and takes a lot of time and experience to make sure that things run smoothly for it to be a successful procedure.
Absolutely. And the moving parts are, the human part, the machines in the room, and there's plenty of them. Healthcare technology is increasing by the day, and we're, as surgeons, increasingly using more and more complex technology. So there's human factor, there's machines, and clearly there's the patient. We tend to forget the most important moving part in the whole process is the patient, who's central to all of this. We tend to focus on us as teams and as machines and so on. But really, the core center of all of this is the patient in the middle of the operating room, often asleep, often not aware of what's going on around them. Until the end of the day, or the next day, as it were, when they wake up from sometimes quite complex surgery. So, the people, the patient, and the procedure, the 3 Ps, as it were.
Yeah. And how long would an average surgery last then? You?
So the majority of my surgeries are, 1 to 3 hours long, relatively short cases. I mentioned in the intro that we have a wide scope of surgeries that we do. The majority, I have to say, day in, day out procedures are 1, 2, 3 hours, maybe 4 hours maximum. And we then get once a week, or maybe once every 2 weeks, quite complex surgeries that involve multiple teams that I mentioned earlier, that can go on up to 14 or 16 hours procedures. So they vary. When you're looking at these long, lengthy, complex procedures, you're looking at multiple teams working at the same time, sometimes taking breaks at different times. You compare it to a long flight, having a reserve captain and reserve crew, stuff like that. Similar idea. There's many parallels with the airline industry. That comes out a lot when you read about organizations in healthcare and the airline industry.
To make sure that you don't overlap on the level of concentration that you've got, and another person comes in and a team and takes over.
Exactly. Yeah. It's these lengthy procedures that really ramp up the risks and the complexity and what we do. But at the same time, that's what we train for in these congresses and these meetings, and in our in-house training, which happens quite regularly, to keep everyone really on top level. Training, knowledge, stamina, ability, and all these other non-technical aspects that we have to work with as a team.
I think as well, there's a lot of correlation between what you do as a surgeon and also as an investor, because like with you, I guess when you have a patient, not every patient is the same. You don't really know until you get into the nitty-gritty of it what you're going to find or what you're going to discover, and you have to kind of stay patient and know that from your experience it will always work out okay. And I think a lot of that is the same with investing as well. Obviously, the podcast is called Emotionless Investing because the idea is that we learn skill set, mentality, capabilities that we can remain calm and patient, invest. And like now we're in July 2022 and we're going through a turmoil time with the markets and inflation and interest rates, and markets move, and it's probably the same thing that we don't know what tomorrow or in the next 6 months is going to have, but staying patient, trying to learn from previous experiences, that we know that markets will go up. Like I'm sure with your confidence with you as a surgeon, you've done, how many surgeons have you done in surgeries have you done in? Do you keep a record of it? Do you?
I do, and most surgeons will keep their own surgical log. They don't have to, but most surgeons I know, certainly trainee surgeons, certainly when you're training, you have surgical log. It's part of your training and part of your progress for reassessment and evaluation, and finally for being signed off as a fully trained surgeon. But once you're fully trained and certified and qualified, you don't have to keep a log. I do, and I know most of my colleagues who I know will keep a log. Thousands. You'll run into thousands. So I couldn't give you an exact figure, but it's certainly thousands of surgeries.
But it's enough for you to then pull out, your confidence and know that, you've been doing this, thousands of times. And if something's not quite going right, I guess does that give you instill, calmness and confidence to be able to say, look, we know we've been here before many times, and everyone remain calm and just stay patient, and that you'll get the best results that you can.
Absolutely. It not just gives me calmness, but it gives my patients, because often patients come to me and ask me, doctor, how much do you know about this procedure? Let's face it, patients sometimes are having very complex, 16-hour operations. When the mention of that makes them really panic, and they want to know what's the risk of that procedure. And they often ask me quite, in black and white, have you done this before? Obviously not knowing me and not knowing my background, and have I had complications before? And I'm quite open with them, and I then give them the figures that this has been done in this center by me, by my team, X number of times. I'm open about complications. No surgeon hasn't got complications. That's just reality. And that log, keeping that log of that many cases, gives me the opportunity to look back and know I've had so many complications, I've had so many successes, so many failures, etc., etc. So that's a good point, actually.
And how many years have you been doing it now in total?
A long time, James, a long time. So I mentioned that I qualified in dentistry about 3 decades ago. It's 30 years.
Okay. I mean,
just
when
under,
you're in,
once you get decades. Yeah.
I think they say once you get past 25 years of any profession, you're classed as a master in it. So what would you say were the contributing factors to you becoming where you are today? And I know you're very, very well respected in the industry and also as a doctor in general. What would you say? I mean, it's not just the hours. There's obviously something that's made you who you are and made you strive for, perfection and to be an elite doctor. What do you think that is that's contributed towards that?
I think there are several things. One, I mentioned earlier, the family, the impact. That has some impact. I can't really ignore that. Having a sort of a guiding figure who happened to be a surgeon as well, actually. So, not a physician, not a gynecologist, not a psychiatrist, but actually a surgeon and a practicing surgeon who got up to be, quite senior, became a professor of surgery and quite revered, quite respected senior surgeon. So that really has left an impact, a direct impact on me. So that's number one. Number two, I think this choice of specialty, this unique specialty where you have to train for like almost 2 decades, and the challenges that brings with it, that really brought a lot of challenges. I had to, travel from one country to another, move to live from one country to another. That brought challenges. I had to go back to university to become a student again, having already qualified. I had to get married during my second university degree, have kids while I was a student, second time around, and a whole lot of other challenges, including, as I say, moving to a different country, having to earn while I was studying university twice, etc. And then challenges of just trying to progress in a specialty which is actually quite tough to progress in. It's not easy. It's quite challenging, like any other surgical discipline. So that was another aspect. And then I guess the last challenge was moving country again, coming to the UAE. Yeah. That brought another challenge to me, having practiced and stabilized in the NHS for many years in the UK, and then having to make that big decision to shift to the UAE was a big challenge. But life of a surgeon is full of challenges, and I take it as a positive thing, not as a negative thing. But it did help build my progress and my confidence, if that answers your question. So it's a series of all these challenges and inputs, as I say, from family, from work, etc., etc.
Because the challenges bit I find fascinating, because we've all got the same amount of hours in the day and we're all presented with the same challenge. But there's some people that say that's too difficult. I'm not going to do that, or I'm going to try half of it. And there's some people that say, will rise to it and say, do you know what? Because I'm looking at this in the future, I'm actually going to do it. I know it's going to be difficult, but I'm going to overcome it. So obviously, success to and well done to you for obviously achieving that. Was that mainly the things that you mentioned about, the willingness to do it because you're following in your father's footsteps? Was that what gave you that drive to overcome the challenges?
Yes, initially. I mean, that was the initial drive when I was young, clearly much younger than now, having that sort of father figure and somebody who was clearly successful in their career as a surgeon that I could look up to. And then once I got on the right track, it then became a kind of a self-fulfilling, challenge accepted kind of situation, and just keep progressing. And that happens for every surgeon, regardless of their background or their family, influence. You want to get better. You want to be the best. You want to. It's quite
Competitive.
quite competitive. Let's face it. Most of healthcare, most of medicine is surgical disciplines, and no less than that. And then you just want to be better and better at it. And the more senior, the more leadership roles you take, you then, as I mentioned earlier, your psyche and your mindset becomes that of just wanting to achieve and get higher and higher and higher. For your sake and for your patient's sake. It's not just a self.
Yes.
It's just a selfish.
To have more of an impact.
Yeah.
That's nice. And so moving on towards retirement, I mean, do you think you will ever retire? Do you think it's something that you'll want to do for as long as you can? Be a consultant. When I say consultant, I mean not with a hospital, just pop in and out, or what's the plan?
I mean, I'll certainly retire at some point. I guess we all have to at one point, but I will, as long as I am physically and mentally able, will want to practice as a surgeon. So I will, I'll continue to do that well into, I don't know, I can't give you an age, but as long as I'm able to physically and mentally. The physical aspects of surgery mean that you really need to have a certain amount of physical, stamina, energy, focus, and mental focus and ability. So as long as I have that, I'll keep going.
Yeah. And what does, I use the word a lot, financial freedom with clients, and we're talking about getting people in a position where they have income coming in that is the same or more than their salary or expenses, so they feel financially comfortable. But what would that mean to you, financial freedom?
For me, really, it's a good retirement, and the ability to, even if I'm not working as a surgeon, to be able to have a good lifestyle, and also being able to give even beyond retirement, if not as a surgeon, but as a trainer, as a coach, as a teacher. As I said, there are various facets to a good surgeon. So that's if I'm able to do that in retirement with a good financial setup, then that's good financial freedom for me.
Yeah, and I guess, I mean, you just mentioned a good point there, which I think is brilliant, and a lot of it is giving back. You might spend 50 years in your career being a surgeon and becoming an expert master at what you do, and what nicer thing to be able to pass that back to other people, maybe to your boys or to anybody else that is wanting to be a surgeon. Do you think they'll go into medicine, or is it too young to say?
It's too early to say, but I've had very, very brief discussions with them, and suffice to say they were very brief, and not because from me, but from them, is that what they see in their father, and it's interesting, the generational differences, what they see in their father working so many hours and so on, actually puts them off. They don't seem to be interested in that kind of thing, and this is a generational thing. When I used to see the same thing in my father, I used to be quite impressed with that, and that's, as I said earlier, made me become a surgeon. But my boys see that in me, and they say, "No, Dad, thanks. We don't think so." They're too young, admittedly, but we'll see. We'll see.
Yeah. Well, that's I mean, it's inspirational what you've been discussing there, and I always like to see what you and follow what you're doing on Instagram. and sorry, you post it on LinkedIn. And anyone that's listening.
Speaking of LinkedIn, I do have a very active LinkedIn account, as you say. And I think that, you know, that brings up the issue of social media and how that can be very influential now. I mean, when I was training, none of the social media existed. In fact, internet was, you know, quite new. So that social media nowadays is really, really quite influential, not just socially, but professionally and in all aspects of what we do. And that's why I use it quite a lot for partly giving back, but partly for educational purposes through certain platforms. LinkedIn is one of them. And I'm glad that you found that useful, because that's one of the purposes of using such platforms, really, making people aware of what's going on in my profession.
I think that's exactly it, awareness. And I had obviously spent quite a bit of time with you. I had an understanding of what you did, but when you visually see it, you see the before and afters. You know, it's incredible. It's incredible what you do, and also I think that as the body as well. I mean, the body is very resilient, isn't it? It can repair quickly and you know, build if things are approached correctly. But it's it's impressive what you do.
And for us, it's specifically quite challenging. We deal with people's faces and nothing else. We don't do any other surgery on any other part of the body except when, you know, when doing other related things, but mainly focused on facial surgery, and that really can be challenging. But as I said earlier, the challenge is what keeps us going. Yeah.
Well, thank you very much for your time, Khalid. And I'm sure anyone listening will find it inspirational and be able to check out some of the work that you're doing.
Thank you for having me.